Okay, says we're live. Good morning. My name is Annette, and I'm here with Anna. We are both outreach counselors with COVID Recovery Iowa. And if you're not familiar, COVID Recovery Iowa is a FEMA-funded grant that's here just temporarily during the pandemic. When there's a disaster that's declared, the state can go to FEMA to get funding for the mental aspects of a disaster, and that's what COVID Recovery Iowa is. We are here temporarily. But we are here to connect with you. And then if we need to, we can refer you on to other agencies and things that are there and that will be there permanently, whereas we're just temporary. You can reach us at 800-447-1985 or 844-775, 9276. I can't read my writing. Or covidrecoveryiowa.org. And today we're here to talk about the differences between different mental health professionals. So it gets confusing because there's all different kinds of titles out there. So you and I are outreach counselors for COVID Recovery Iowa. So what's the difference between what we do as an outreach counselor and what a mental health counseling is?
Yeah, so it definitely can be confusing. I think people hear the word counseling and they group everybody together. But yeah, we do that outreach counseling, also like disaster crisis counseling. And so that's different than other mental health treatment. Usually the way that services are provided. And so I got this information from FEMA, and it basically says, so what we do is provided through the crisis counseling program. And mental health treatment is usually within the mental health community, and they provide assistance to individuals with existing pathological condition or disorder. And then they'll go through treatment options and interventions. And so that's more mental health treatment. And we do individual and group encounters. So like you said, we reach out to those impacted by a disaster, which for us is the whole state of Iowa, since it's a world thing. And we just engage with those people and we encourage them to talk about their experiences, what COVID has done to them specifically for us, and help them manage their stress. And we can do different activities. We also do additional reach out to like community centers, like libraries or schools, and just let them know that we're here for the additional support. I know we've talked a lot. We don't replace mental health counselors at all. We're just there to additionally help and then refer them on. Mm-hmm. And we, like, I don't have my master's degree right now. I'm getting it, but a lot of the times you don't have to have your master's degree. We're trained through our grant. So we have the specific training for the crisis counseling, but not necessarily like mental health.
Okay, so within the mental health field, we have all sorts of different levels and different titles. So psychologist, psychiatrist, counselor, clinical social worker, certified peer specialist. There's so many different titles and different types of care. So what's the difference between all of those?
Yeah, that's a great question.
That's a big question, so break it down.
So get ready for a lot of information. I'll try to keep it brief and understandable. So I had help from the National Alliance on Mental Health for this information. They helped me break it down as well. So first, we can talk about a psychologist. So they usually have a doctoral degree in psychology or a field of psychology.
Okay.
So they evaluate a person's mental health. They use a lot of like evaluations and testings and interviews. And they make diagnoses and they can also provide individual and group therapy. But when I think of a psychologist, and this just could be me, I think of the more they're evaluating, they're running the tests on people, they're figuring out that initial diagnoses of somebody. And they can also have specific specializations too, of like children or substance use, which most of these can have those specializations.
So they might specialize in one certain type of mental health.
Yeah, so they could just work with children and do these evaluations on children and tests.
Could they do something as specialized? I'm going to specialize in people with ADHD or behavioral issues, or
they could.
Okay.
So they could say like, this is sorry, what I'm best at, or like what I know the most about.
Okay.
But they could do anything.
Okay.
Yeah. And so the next is psychiatrist. So it's very close to psychologist, but a psychiatrist has a doctoral degree as well. Let me get a drink of water quick. They have a doctoral degree and usually medicine.
So they can prescribe medication.
Yes, that's the main difference, is that they are licensed medical doctors and have completed additional psychiatric training. And so they can diagnose mental health conditions as well, but they can also prescribe and monitor medications. So you can't go to just like a psychologist and get prescribed medication unless they also have that degree in medicine. Or just a doctor can also prescribe medication as well. But psychiatrists specialize in the psychology aspect of medicine, and they can also provide therapy as well and have their special fields.
Okay.
And next is, they group these ones together. So counselors, clinicians, and therapists. They have different titles based on where they work. So based on their treatment center. And so they have a master's degree in a mental health related field. So psychology, counseling, marriage or family, one of those. And they evaluate a person's mental health and use therapeutic techniques based on specific training programs. So there are different techniques counselors can use and be specialized in for different things. So there's just a bunch of them. I know one week a Facebook Live was about EMDR, and that's a specific type that a counselor can get certified.
We did a PCIT one too, for parent-child intervention therapy, or
I think that's,
we did one of those too. So that's another type of therapy that a counselor can.
Right. And there are different techniques for different things. So EMDR is specialized for trauma. There are other techniques specialized for depression or anxiety or ADHD and stuff like that. And so you can kind of decide when you're becoming a counselor if one of those stick out to you, or you want to work with a specific group of people. You'll most likely want to get specialized in that. And so, yeah, they really just help. And what they do is they help with symptom reduction and just better ways of thinking, feeling, living, kind of help them have a better quality of life.
So give them techniques to work through whatever their, what their issue is.
Right. And some of them will do techniques. I know others are, they just use different types of counseling to help people. Mm-hmm. So sometimes like exploring their past and talking about maybe where what's happening now is coming from. And so it could be a whole different type of things.
Right.
That's
Yep.
what I'm getting my master's in. So when I'm done with mine, I'll be a counselor.
Okay.
And they have different licensures. So you can specifically be like a licensed marriage and family therapist or a child therapist.
Okay.
Yeah.
So then we have clinical social worker and we have social worker. Those are the next two.
So I'll start with clinical social worker. They have their master's degree in social work. They are very similar to counselors, clinicians, and therapists with evaluating a person's mental health. They can do that, but they also are trained in case management and advocacy services. So they can do the additional, what I tend to think of what people usually think social worker does with the case.
See, when I think of social worker, I think of those case management. That's what I'm thinking of. I didn't realize that social workers also could do the counseling part of it. So
yeah. So the clinical social workers can do that counseling aspect.
Okay.
But just a normal social worker without the clinical, they just need their bachelor's degree.
Okay.
And they can provide the case management, do like inpatient discharge planning services, placement services, and just use those other services to support healthy living, but not necessarily the counseling aspect.
Okay.
And then the last one I had on here is a certified peer specialist. And I learned about these, and they're kind of becoming more popular in like teams. They like having a peer specialist, and it's because they have lived experience with a mental health condition or substance use disorder. So they've actually lived with that, and then they're trained and certified and prepared to assist with recovery by helping a person set goals and develop strengths. And they just help provide that support, mentoring, and guidance.
So there are the certified peer specialists are somebody that's already gone through what the group is going through, what people in the group have gone through, and then they've gone on and been certified.
Yeah, so they've had that lived experience, which is why a lot of people maybe will like having a peer specialist, because it's somebody that knows everything that they're helping a person go through. And it helps because they have that training and certification, which some people may be like, well, what if working with somebody who's in that now, like, will that set them back? But, you know, to become one of these, you are trained and you do have that. And they often have support too. To help them, but that can just be helpful for those that you're working with.
So I have a comment. If anybody has any questions, feel free to, because I am monitoring that. But Mandy says, good info about certified peer specialists, certified and lived experiences sounds helpful. And I can see where that would be helpful for somebody that's going through, you know, whatever it is they're going through, to know that somebody else has gone through it and gotten better, you know?
Right. It gives them that aspect of hope. Like,
right.
I've been where you have been, and this is where I'm at now. So
right.
Like, things do get better.
And they've probably gone through some of the struggles and the setbacks that these people have gone through, you know, that are currently going through it. And so they can relate and help them get through those as well too.
Right.
So.
They're very specific to those scenarios or experiences, and can say like, okay, I've known this too, and this is what has helped me, and walk through them with that, I think.
Yeah. Kind of, those have been around for a while in various groups, but now they're taking that extra step and getting some certification so they can really help people. So that's awesome. Or maybe they've got a title now. I don't know. But I mean, I know there's groups that have used that type of a thing where you have a mentor that's walked through that with you before. So,
a common one I think of is like AA.
yes. Yep.
Yeah.
Yeah. So that's helpful. Thank you for doing all that. And I knew that like psychologists, psychiatrists, I knew one of them could give medicine, but I could never remember which one. So yeah. Yeah, I didn't realize there was all those different ones. And like I said, I didn't realize there was a clinical social worker. So thank you for giving us all those definitions. I don't see any other comments or questions. So if you have any, go ahead and put them in the chat if you're not watching this live and you have questions, and we'll get back to you with the answers. So thank you very much, Anna.
Thank you.
Bye.
Bye.